Hello and welcome, my name is Chris from christopherhole.com. Thanks for coming to watch this video where we're going to be looking at plantar fasciitis. We're going to break it up into three parts. We're going to look at what it is, which will be very quick. We'll look at some anatomy, and then we'll look at some potential treatment. But with regards to treatment, again, just use this as education rather than a diagnosis or self-diagnosis of plantar fasciitis. Go and see a health professional, get it properly diagnosed and properly treated. This is more to help educate you around the condition, so when you go and speak to someone, you have a better grasp of what they're talking about. So, what is plantar fasciitis? Well, it's an inflammation caused by the excessive stretching of the plantar fascia. So, what is the plantar fascia? It's the tissue that goes from your heel bone, the calcaneus, all the way down to the base of your foot, which is where the phalanges and the metatarsals are. So the bones of your toes and the bones, the first long bones of the foot, the metatarsals. Not only will we have the plantar fascia involved and the phalanges and the metatarsals, but we'll also have muscles of the lower leg involved as well. Now, many of these muscles will aid the plantar fascia in maintaining a sort of a high arch. So when the plantar fascia is pulled taut, which is kind of the way it's meant to be, it creates an arch in the foot. Now, these muscles on the outside of the foot, so the Tibialis Anterior, the peroneus longus, and the extensor digitorum, and the flexor digitorum. Now, these aid in maintaining sort of an upright arch because of the way they go from the outside of the foot across the foot onto the inside. So if these become slack and the plantar fascia becomes slack, the inside of the foot just drops in. So when we can get the plantar fascia functioning properly and these muscles on the outside of the foot functioning properly, then we get a much sort of more effective arch, if you will, and it will aid the raising of the arch. But if we want to get a properly raised arch, we then need to look further up the chain to the knee and to the hip. So coming back to the plantar fasciitis, these muscles, the tibialis anterior, the peroneus longus, the flexor and extensor digitorum, they all start up at the top here on the outside of the leg and they go across. So they join into such tissues. The tibialis anterior is the base of the first metatarsal and the inside cuneiform or medial cuneiform, which is in here. You've then got the peroneus longus, which is the first metatarsal, which again is here, and the medial cuneiform, which is here. And then you've got the flexor and extensor digitorum longus, which are the base of the first four phalanges. So they join all the way down here on the big toe, and then that would be number 1, and then toe inside 2, 3, and 4. So all of those will aid in maintaining a good integrity to your arch. So how we would treat that is by addressing the underlying reasons of the issue, which could be biomechanics, it could be poor footwear, it could be an increased weight gain, it could be an increase in activity, it could be reduced tension in the gastrocs and the soleus, and then it could be excessive tension in the dorsiflexors. So first of all, we've got to understand what that is. So it could be a process of elimination. So places I would start would be your biomechanics and your poor footwear. So if you're heel striking, that could be a part of it. If your trainers are old, that could be a part of it. What we would then come on to is did your training go through a very sudden increase? So let's just say you were doing 20 miles a week and you all of a sudden jumped to 40 miles a week, because that can have an effect on it. If we have excessive tension in dorsiflexors, which are the muscles of the back of the leg, so the gastrocnemius and the soleus, then we want to be thinking about a manual therapy to reduce the tension there. And then finally, it might be bringing frictions into the plantar fascia. So that might be sort of pushing thumbs or fingers into the plantar fascia to encourage greater blood flow, to encourage the lengthening of the plantar fascia so it's able to function more optimally. So to summarize, First of all, what is plantar fascia? It's an inflammation caused by excessive stretching. Then the tissues that are involved are the plantar fascia itself. Then you've got the tibialis anterior, the peroneus longus, peroneus brevis, and then the extensor and flexor digitorum longus, because they all attach onto the inside of the foot. And then treating it, we want to first look at biomechanics and poor footwear. Then we might look at increasing a sudden increase in activity. Then it would be to reduce any tension into dorsiflexors, i.e. the gastrocnemius and the soleus, and then frictioning the plantar fascia. So many thanks for watching. My name is Chris from christopherhall.com. I will speak to you in a future video.